All right, so welcome. I'm glad to have everybody joining us tonight. I hope everybody can hear me okay. We're very excited to have you join us, and we're going to kind of do a little just a information session to kind of let you get to know us, provide you with some information. Most of these things I think you can find on the website if you haven't been there, check it out. But we're here to answer questions, and we'll go through a little presentation at first just to give you some generalized information, and then we can get into specifics. You can ask us any questions you want. Can't promise you I'll always have the answer, but I'll definitely try or find somebody that can answer it. Dr. Dorn, can you switch the screen? There you go. She's got control of it. So basically, we'll just start off with a little bit of who we are and the DNP-NA faculty. Of course, my name is Dr. Ross Castile. I'm the program director here at FranU. A little bit about myself. I'm a CRNA now for, I think, 17 years. I graduated from TCU many moons ago. I worked in Baton Rouge pretty much my whole career, anywhere from hospital to office-based anesthesia to pediatrics, all different kinds. My main focus in the, my last couple of years of active practice constantly was big into cardiothoracic, hearts, lungs, those kind of things. And currently now a program director and work 1 day a week in the hospitals. So we still active clinically, and married, and I have 2 little girls. So I'll let Dr. Dorn, who is on here, actually introduce herself.
Hey everybody, my name is Callie Dorn. I'm the assistant program director here in the nurse anesthesia program. This is my 5th year with the program, and I've been a CRNA in the Baton Rouge area for about 9 years. And Dr. Castile was actually my clinical coordinator back in the day when I went to school at TCU. And so I came back to Baton Rouge after graduation and have been here ever since. Worked at Our Lady the Lake Regional Medical Center and several other facilities across Baton Rouge. I currently still practice clinically at the Baton Rouge General, Our Lady the Lake, and Ochsner Medical Center, if y'all are familiar with any of those facilities locally. I am the assistant director, and I also teach the advanced health assessment course. I've had a lot to do with the DNP project series, which is kind of something you get to later on in the program. I've taught several of the principles of anesthesia practice courses, and I teach some of the online courses as well. And I do a lot with the admissions process. So y'all will be hearing from me quite a bit.
Thank you, Dr. Dorn. So continuing on, and I don't think all of the faculty can make it tonight. A lot of them are working and doing things. So Dr. Dorn are kind of taking Dr. Dorn and I are kind of taking the helm on this. But we also have Dr. William Schreider, who is a PhD, and he is our research director and also teaches our chemistry. He's got a chemistry PhD in chemistry. So really, really smart guy. Knows a lot of things that I probably can't draw or understand as much as him. So he's a great guy. We also have Dr. Amber Poirier, who is our director of clinical education. So she is the one that is in charge of, once you get to clinicals, she's placing you in, we have 17, 18 clinical partners. She's placing you in the sites. She's working on your rotations, moving you different places, kind of manage your entire clinical aspect in terms of where you are. And then also she's in charge of meeting with all of the clinical coordinators, all of our different sites, facilities, and making sure that you're getting treated right and getting the training that you need. We also have Dr. Mandy Broussard. Dr. Broussard has been with the program for, I'd say, 8, 9 years, or maybe even longer. She's been here a while. She is actually a previous program director, assistant program director, director of clinical education, professor. She has done it all and knows and is all knowing about that. But her main love is teaching students, and she really likes being in the classroom. So that's where she spends her time teaching pharmacology. You will have her for multiple courses in pharmacology. Next up, we have Dr. Lindsay Williams. Dr. Williams has been with us for 3-4 years probably. And she is a graduate of FranU, teaches in various courses that we have, including our lab and some OB and pediatrics. Dr. Albert Swafford, who's a PhD physiologist, will be teaching your anatomy and physiology classes. You will get to know him very well, especially when you come onto campus. And then finally, we have Dr. Beth Crochet, who is our lab simulation director. She is in charge of, simulation. She works all the lab equipment. She is in charge of integrating all of these fancy toys that you'll hear about in just a few minutes into our curriculum. And she also teaches in Principles 1, which kind of teaches you basics above anesthesia, and also in some of the regional courses as well. As far as additional staff, we also have Ms. Lynn Savoy, who is our academic support coordinator. She's kind of the I guess the glue that holds the front office together. The students, she's very helpful to the students. They become, I guess, almost like a mom to them. She takes care of them. She, sometimes lies for them, no, I'm just kidding, but she definitely she tries to take care of them, not let them get in trouble, and get them everything that they need. So you will get to know her very well if you come visit us. She is a big asset to this program. And then last but not least, we have Tilly Parkin, who is the graduate recruitment coordinator. She is actually on the call right now, so I don't know if you want to say hi, Tilly.
Hi, everybody. I'm sure we have talked many times, and we will talk many times in the coming weeks until your applications are complete.
That's right. She is the expert in knowing all things about applications and how to manage them. And so she will field a lot of questions for us. And sometimes we will actually send them to her, because if it's not 100% anesthesia related, I might not be able to answer it as well as she does in terms of the admission process. So just to give you a little bit of, other people that kind of teach and help with our staff, we have CRNAs, we have anesthesiologists. They will actually be training you in the clinical environment. Most of our students work with CRNAs daily. Anesthesiologists do help out at different facilities, and we don't place students in facilities where we have, strained relationships, I should say. We are actually in a very, very good place right now that there is a huge demand for CRNAs and in turn CRNA students. So that makes it a really, really good time to be coming into anesthesia. They're more than willing to help you with all different types of learning blocks, airways, different types of skills. So it's a great time to be here. We also have over 100 clinical preceptors that work with us within the program, and those are basically your individual CRNAs who are at the different facilities that will be training you. We have distance learning adjunct faculty. So these are actual faculty that we employ that, we have some that are in Texas, we have some that are in Baton Rouge, we have some that are in Mississippi. And what they actually do for us is they'll teach some of our online or hybrid classes for us. They're all doctorate prepared. And they also help with some of our DNP project as well. We have guest lectures that we bring in. We like to consider ourselves to be, experts in anesthesia, but there are things that I can say that I'm not currently an expert in, or something that I don't practice as much. So we are not afraid to bring in those people that are the experts in different areas. And some examples of that would be we bring in regional experts that, with 30, 40 years of experience to come in and train you on different things that, while we can teach you these things, it's much better to have somebody who's done this for a really, really long time in certain aspects to bring you in. So we bring in guest lecturers when necessary. We also have professional workshops, which are, part of those guest lectures and provided by the university. Dr. Dorn.
All right, and I'll take over, just kind of explain to y'all a little bit about, where we are now and where we came from. So we first enrolled our first cohort as a Master's of Science in Nurse Anesthesia program in 2005 as Our Lady of the Lake College. In 2015, we transitioned to a Doctor of Nursing practice in nurse anesthesia, and our university has since become named Franciscan Missionaries of Our Lady University. So you may be familiar with the name Our Lady of the Lake College, but that we're pretty much one and the same. Our program has been around for a long time, and we've really done a great job. We have a lot of pride in our graduates. We've graduated a total of 421 graduates with a total all-time first-time pass rate of 94.5% on the national certifying exam, which is that big test that you have to take at the end of the program that says that you can officially practice as a CRNA. So we're very proud of that. We have several alumni that work for our program, as Dr. Castile mentioned. Dr. Poirier, Dr. Williams are both graduates of our program, as well as many, many adjunct faculty and clinical preceptors that work for our program. Tell you kind of a little bit about how the program is structured. So we include, it's a 36-month program. The first several months, the first 2 semesters are all online and all asynchronous. And what asynchronous means is that, there's no face-to-face courses or no times where you have to meet with your instructor at a certain specified time. So that allows you flexibility to be able to live wherever you want, work full-time. I'm one of the only faculty who got my doctorate degree with my first anesthesia degree. And I can tell you that the ability to continue to work while, participating in some of this online education is a huge incentive for our program, and helps you save a little bit of money at the beginning before you start having to take out all of those student loans. So that's the first 2 semesters of the program. The rest of the time you would be on campus here in Baton Rouge. Our curriculum consists of 100 credit hours, and those, are online classes. Those are face-to-face classes, and some of them are hybrid, which is kind of a blended, mixture of online and face-to-face courses. Our students, towards the end of the program, they all complete a doctorate scholarly project, the DNP scholarly project. Right now, our students are completing a systematic review of the literature on an anesthesia topic that they are interested in. And so they disseminate their project and their findings in a variety of different ways, including poster presentations, a research and scholarship showcase that takes place here at the university level, and several actually submit for publication to various journals. Our students also complete 2,500 clinical hours at various clinical sites across Louisiana, and we have one in Mississippi. We have a total of 17 clinical site partners, and we are in the process of contract negotiations with several other sites, and we'll kind of talk about those specific sites here in a little bit. So as I said, our program can be divided into several different phases. Phase 1 is kind of the online portion of the program where you can live wherever you call home, continue to work full-time, and that is strictly online curriculum. Phase 2 happens in August or fall of your first year of the program, and that's kind of the heaviest didactic semesters, and that consists of about 2 semesters, and that's all before you would start clinical rotation. So you'd be taking courses like anatomy and physiology, pharmacology, starting to delve into those principles of anesthesia practice courses. And then we also have some simulation curriculum enrolled in all that. Phase 3 of the program is kind of when you start your clinical rotations, and that consists of about 5 semesters of didactic, clinical, and DNP scholarly project curriculum. Dr. Castillo?
Yeah, so I'll kind of dive into just giving you a little bit more information about some of the things that we do, our professional development, our grants, and our endowments. And these are things that you can take with you if you apply to FranU, you don't apply to FranU, you go to any other program. These are important things to kind of note and just to kind of take with you. How's the faculty? Well, 100% of our full-time faculty is doctorally prepared. So I'm pretty sure not every facility, not every school has that. Does it mean something? I think so. I think it shows that if we're gonna teach you and make you doctors, then we need to be kind of up to the same standard and training. And most of us have had it for quite a while. I think I got mine in 2011, so we were kind of. It gives you an idea, maybe a little bit ahead of the curve and forward thinking and where we saw the education process going. One of the things we mentioned was the Maverick Focus workshop, which are actually 2 guys. It's more than 2 guys, but they're out of Fort Worth, Texas. David Gaskin and Dan Nash. These are guys that are very, very well known in the the anesthesia world, especially recently. Dave Gaskin has been known for doing stellate ganglion blocks and helping people regain their taste and smell from COVID. So that was kind of a big deal. If you Google their names, you'll see that. Well, we decided that instead of sending our students to, go and learn this somewhere else, we contacted them and we actually brought the course to us. So they come every year, and we have what's called a senior symposium, and we bring in this course with about, I guess it's about six to eight instructors. They come in, they bring in ultrasounds, they use our ultrasounds, and they actually bring in cadavers. And these cadavers are pulsatile cadavers. So they actually have a patent on being able to make the, cadaver, the arteries actually pulsate. So when you're doing ultrasound guided nerve blocks, you can find these arteries and, actually needle on real, human beings. There's no other experience like it. It's one of those things that, is unique to maybe not just our university, but not very many do this. So we also do an ultrasound course, this course where we teach point of care ultrasound, and we do the regional, and we do that all in one weekend. So they kind of originated that course with us, where it had started with just doing the regional workshop, and then we decided to add the POCUS course to it after all of the faculty had gone and actually taken their POCUS course first. Some other things that we do as faculty is actually coming up very soon next week. All of us are going to attend the Assembly of Didactic and Clinical Educators Conference. So while it is nice for us to get out and travel, a lot of times we're doing this for a reason, and it's to meet at these conferences, where these are strictly conferences of CRNAs, but not only CRNAs, that there's program directors, there's assistant program directors, they are clinical faculty, they're educators, and it's all of these topics that are important to curriculum and people matriculating through our program. So it's a really good thing, and we strive for our faculty and staff to be in the know and up to date on the most current literature. And one of the ways to do that is to get out there and network with other universities from around the country. As program administrators, Dr. Dorn and I have both taken workshops held by the COA, which kind of, guide you on your way to becoming leadership, kind of a mentoring thing. So it's very important for us that we become familiar with the standards, and we develop good relationships with these accrediting bodies that we work very closely with. We send people to simulation conferences, which helps with, when you're in lab, and we do Steph, and you'll hear about this. It's a simulated environment that we're building for you. It's kind of all the rage in training now, and it allows us to do some really interesting things in a safe environment, but still to kind of challenge you. And that's what Dr. Crochet is big into for us. She actually is also an item writer for the MB-CRNA. So what this means is that national exam that you have to take, she is one of the people that works on the questions and writing the questions for that. So no, she can't give you the answers, but the good part about it is it's giving you an idea that the way we write our questions on our exams is built based on the test that you're going to have to take to become a CRNA. So it's not like, you're flying through our program, you're doing great, everything's amazing, and you're taking these tests that aren't very challenging, or they aren't up to the level of the MB-CRNA. When you get there, it's going to look just like ours. They're familiar with the style of writing, and we all try to write to the same standard. I don't know about y'all. When I was in school a long time ago, the answer was right because I said it was. That's kind of how the professors were. That's really not the way to do it anymore. We sample our questions. We make sure they're good questions. We run statistics on them, all the same things that these national certifying bodies do. We do that at the local level too. So we think we're giving you a heads up on that. As far as grant recipients and authorship, we've had several faculty and write for grants, federal grants, HRSA grants, Board of Regents grants, which are state levels, and get them. And they do this. It's not a requirement for faculty to do this. It does look good for them in terms of a scholarship, but some of these things, the last HRSA grant that we just completed, I was basically just an editor on one of them, and it was 45 pages long and took weeks to write. But the advantage of this is we're getting money for the university that we then in turn give to you. Especially, you know, the HRSA and the Board of Regents. We do all of those things to make you get the best equipment and above and beyond that, it doesn't have to cause increases in tuition to where you can't afford to go to school. So we're really, really trying to do those kind of things and give back to our students. Doctor, you want to talk about the LCMC partnership real quick?
Sure. So lots of details to come on this, but LCMC is a health system out of New Orleans who has really kind of taken off in the last several years. And they currently have 6 facilities, about to be 7 in the New Orleans area. And they basically reached out to programs across the state and said, you know, solve our healthcare shortage problem, our CRNA, nursing shortage, all these different disciplines. And so we wrote to them a proposal for tuition reduction for our students, and they liked our proposal. And so we have been selected as a finalist and have been awarded a partnership with LCMC to offer our students tuition reimbursement. And like I said, a lot of details to come, but it's $32,000 in tuition reimbursement for a 2-year work commitment, or $64,000 for a 3-year work commitment. So you can see how that significantly offsets the cost of attendance for a CRNA program. We know that you guys are spending a lot of money, and so we're super excited about this. We've executed a contract with them, and we're just kind of hammering out the details right now. So we're just very excited that we can offer that to our students.
And Dr. Dorn was the main writer on that, and did a really great job with that. So thank you. And that's, once again, she didn't have to do that. This was something that was presented, and she said, let's take a shot at it. And $1.2 million later, this is the result of it. So we're always looking for those types of things, and we're gonna keep pushing to try to make not only our university better and align ourselves strategically with the partners that we need in the state and on the national level to get you the training that you need, but also to get them to kind of pony up. Hey, you want us to come work for you? You know, let's offset the cost of this kind of stuff. So we're really we're excited about that, and I have a very strong suspicion this is not the first partnership that you're going to see. So just to let you know, we are working on that constantly. A little bit more about the HRSA grant. Currently, the HRSA grant was written for 3 years. This is the last year that of this particular one where we got $35,000, you know, a little over $35,000 annually. The new one that we just submitted for would replace this one, and it would be in place for another 4 years, and it would be roughly the same. You know, they didn't tell us exactly, but probably in the $35,000 to $40,000 range. And what we do with that money is we take it and we can use it for anything to train you. But what we've chosen to do is take that money and give it to the students. We break it up amongst the students evenly, and allows them to go to outside rotations where you're having to pay for room and board. This helps offset the cost of that. We also use one of our Board of Regents grants, which was written for, that was $80,000. So when you combine that, you know, we $115,000 annually that we're taking in, and instead of using it for, you know, salaries or things of that nature, we turn around and we give it right back to the students to help you get out there and get the training that you need. And traditionally it puts you in rural areas or in areas that, you know, are economically underserved. And it puts you in a situation where you can really get out there and help people. And we think that, you know, we don't want to hinder your training because of cost. So if we can offset that, we will. The Board of Regents grant, we are continuing.
Sorry, it's Hayes interrupting. Sorry. It equates to about $4,500 per student for your clinical rotations.
Right. And while none of that is absolutely guaranteed, it is guaranteed for next year, and we are continuing to write for these things. And there's a very, very strong possibility that we're going to continue to get them, and we'll continue to look for opportunities. And as long as we get them, we're going to keep passing them on to you. As far as endowments, these are things that professors or faculty write for in order to get things bought for the university, that we can use these funds from donors or from alumni, that they actually have these funds where we even use them to buy these high fidelity simulation equipment that you'll see us talk about in a second. And we're talking about hundreds upon hundreds of thousands of dollars of equipment, probably in the millions after you add it all up. but we keep writing for this and we win these awards that allows us to get this equipment to help better train you. And then, so the Board of Regents grant's another one we use for funding for that Maverick Regional. Instead of you having to come out of pocket for it, we take the cost from the university through the endowment and send those guys over here to train you. Just to give you an idea, it's probably about a $2,000 course for a CRNA to take it. So it's really advantageous. What we use to train besides actual hospital training, and some of this is concurrently while you're in the hospitals and training, but a lot of this is before you even get into the hospitals and put your hands on patients in an anesthesia fashion. We use high fidelity mannequins. So these things are very, very lifelike. The ones you're actually seeing in the pictures here are our older ones. When we move into our new building, we have just secured the purchase of 2 CAE mannequins that are state of the art, that are the best money can buy. We're going to be able to actually run anesthetic vapors through them. So you will be using, it'll be as lifelike as it possibly can be. They blink, they breathe CO2. You can put a bag over their head. They know that they're breathing their own air back. They have lungs, and it's very, very artificial intelligence. And one of our big problems is when you use simulation, if it's not 100% as real as possible, you kind of lose that. So we really are trying to buy the best equipment to train you. We also use intelligent ultrasounds, which we'll get into, OR sim and scan nav technology. These are all different technologies that on the next slides we'll be able to look at. So this is kind of a picture in our lab, just to give you a setup. And this is the lab that by the time you come to our university, this won't be here anymore. It'll be an entirely new facility. But even this facility is, we like it. You can see we have the 2-way mirrors. We have control rooms where we can actually watch you while you're doing different things. And, we can control those mannequins remotely and have them react to you and the drugs that you give in different scenarios we can take you through. So it really gives you that hands-on feel and lets you have a little autonomy to make some decisions. This is the Intelligent Ultrasound is a company that it does what's called Bodyworks by Eve. So this mannequin here, you can see that it can be ultrasound. And when you ultrasound it with a real ultrasound, it actually shows you it projects a real ultrasound on the screen, and we can use it for POCUS where you can diagnose, pericardial effusions. We can diagnose, lung sliding. We can tell if somebody's got a pneumothorax. We can look for fluid around the liver. We can do all these kind of things. And this is kind of a big push in anesthesia right now and bedside POCUS. And so we have these mannequins to help you train that. And we'll run scenarios called OSCEs where we give you a scenario, we bring you in, we let you kind of scan and find, what the patient has going on. That is the basic POCUS. We also bought the ones that you can see in here where we can do actually TEE and TTE on these. And so that's kind of a big push in anesthesia, in my opinion, as well, from being a cardiothoracic CRNA, is getting you to that level where you can compete with those anesthesia residents and those anesthesiologists, where you can show them the views that they need. You can do the hearts, you can see the ejection fractions, you can do all that. And so we have those machines, not one, but actually 2 of them. So you don't have to wait in line for them. This is the OR sim we talked about. And basically what this is, we have 2 of these as well. These are virtual bronchoscopies. So you can use a fiber optic bronchoscope and actually learn the method of, movement and training. And that's one of the hardest things to do, is to get in an OR. You're already nervous. You're trying to use this new toy. You don't know how to operate it. And thus you don't get as much, I will say, like, you won't get as much time, because it's like, hey, we got to keep moving. Well, the more you can put your hands on it in this type of environment, and you can actually see, like, there's a trachea there and the lungs, and then on the right hand side there, you can see that's the actual view of the vocal cords, and you can see the scope moving through this. The other advantage of this is, so sometimes, like even in my class, I can take this laptop, I can plug it into an HDI port and put it on a 30-foot screen, and we can walk through the airway anatomy. We can go through all these different scenarios. We can also use it to, intubate somebody who has a pharyngeal mass or something to that effect, where you may never see that, or you might not see that until you've done thousands of anesthetics. But if we can give you the advanced training to anticipate that kind of thing, you're way ahead of the game. And I really do think that this hands-on stuff makes a big difference with our students when they arrive clinically. You're going to be ahead of any other clinical students who don't have this equipment. I think this is the last kind of toy that we have. Basically, this is what's called ScanNav, and what it does is this is for peripheral nerve blocks. So we actually take a real ultrasound machine, you scan real anatomy, and with that real anatomy, you kind of get the picture that you think is appropriate to do a block based on what you know from your book learning and from your guidance. And this machine has artificial intelligence that can actually, you can see it highlights the nerves, it highlights the vessels. So it's not it's not teaching you how to do the block, but it's reinforcing, hey, that's what I thought I saw. That's what it should be here. And it's giving you that confidence to go for it and to see that, you're making all the right decisions and reinforcing that learning. So this is one of our newest toys that we got. And so we're very excited about using it. One of the other things that we use, instead of actually using a cadaver lab, which a lot of places used to have, now we have what's called anatomage tables. These tables are essentially a human cadaver that's been sliced into all kinds of different frames, and you can actually break it down into just nerves, break it down into just muscles, just bones. You can spin the entire anatomy around to where you can look from the top, the bottom, the side, the left, the right. And it allows you to really get a good view of learning that anatomy and phys that you need without having to have a cadaver and having a cadaver lab. The advantage too, you can zoom in, you can pull out, we can even assign assignments on here and say like, okay, label these 3 different things. And so we use this occasionally in the program to really help with anatomy, but these 2 tables are available for you to use as well. So it's a big deal, especially if you're a real visual learner. A little bit about us personally and professionally. We actually, we're big into professional advocacy as well. So we're not just going to tell you like, hey, you're going to be a CRNA, you're going to go out there and you're not going to make a difference. You're not going to be involved in things. We push very hard, and as you can see, I'm the president of elect for Louisiana Association of Nurse Anesthesiology. So I'm passionate about this. I like getting students to get involved with, what's going on the state level, what's going on the national level, because the more the more it's going to affect your practice. And you starting this now at a young point in your career, and you develop over time, is going to put you and our profession in a great position in the future. This is actually me with I don't know if anybody recognizes this, the AANA president, Dr. Angela Munn. Her and I had dinner together. This is at our board retreat. They're actually holding a declaration from the governor of Louisiana saying that it's CRNA week, and he signed it. And so we're really big into pushing our profession, and very proud of it. We also have other faculty that have presence on the Atlanta Board of Directors. We have student and alumni representation. So in each class that we have an actual FranU student that is on the Atlanta board as a student representative, and they attend all the meetings with me, and they're part of that. And we send them to different conferences, ANA conferences around the country, to get them really involved. So it's something that we're very passionate about, and we hope to kind of instill in you at a very beginning point in your career.
All right, and I'll kind of take over here. A couple other things that we have rolled out as a program. Obviously, we're big about scholarship and teaching you certain scholarship skills so that when you graduate from the program, you are able to recognize a problem at your clinical site or your facility that you're working at, and know how to perform an adequate literature search, implement a policy change, and disseminate your findings. And so part of our DNP project series that is kind of a new part is the service learning component. So our program has partnered with the Boys and Girls Club of Baton Rouge and actually partnered with our program and the nurse practitioner program at FranU to provide a Little Wolf Clinic, is what we call it, to where we go to an elementary school, an underprivileged elementary school in the area, and kind of, walk these kids through what it's like to go to the doctor. What's it like to get shots? What's it going to be like when they take an x-ray? And it's really fun, interactive way to make a difference in our community. So each class will take part in a service learning, and we're actually looking to do 2 service learning projects a year. Right now, we're only doing 1. But yeah, just a fun way to kind of get involved with the community and some interprofessional collaboration with the nurse practitioner program. A little bit more about our clinical sites. So like I mentioned earlier, we have 17 clinical sites. These are some of our community partners in and around the Baton Rouge area. If you're from around here, you may recognize some of these names. Our Lady of the Lake is our kind of partner hospital, and it's right across the street from our building where you would be taking your classes. So Our Lady of the Lake has a main campus, and they also have a dedicated children's hospital. In addition to the children's hospital, they also have a surgery center. And so all of those places you'd be able to do some clinical rotations. Ochsner Medical Center in Baton Rouge, Women's Hospital, Lane Regional Medical Center in Zachary, Baton Rouge General Medical Center, Orthopedic Surgery Center, and the Spine Hospital of Louisiana are all kind of our very local clinical sites that we are able to send our students to. Across the state, we have Our Lady of Lourdes in Lafayette, the Heart Hospital, and just the Regional Medical Center. St. Francis Medical Center is in Monroe. Northern Louisiana Medical Center in Ruston. Acadia General Hospital is in Crowley, Louisiana. East Jefferson General Hospital is in Metairie. And Lafayette General Medical Center in Lafayette, and then New Iberia Surgery Center closer to New Iberia. We also are in the middle of contract negotiations with LCMC for Children's Hospital of New Orleans, and also, help me out, Ross. What's the other one? UMC.
West Jeff.
And West Jeff. Okay. So three additional clinical sites in kind of the New Orleans area. As Dr. Castile mentioned, it's really a great time to be a CRNA student. We are getting our emails blown up with recruiting opportunities for you guys. We're getting our emails blown up with people who want our students to come and rotate through their clinical sites. So we have so many clinical sites right now that we can't even put a student at each clinical site. So that's just a really great place to be for us, because we get to pick our best clinical sites and send you there. So we're excited about some of the opportunities that are to come, and a lot of that is in the New Orleans and kind of North Shore area.
Yeah, I was gonna say we were also in talks with 3 other hospitals kind of in the North Shore area, so kind of expanding our footprint.
And just to kind of tell you a little bit about some numbers, some fun numbers that we kind of calculated out for our students who just graduated. In the last 5 years, our FranU students have delivered 126,827 anesthetics. So huge impact on our local community and the amount of patients that they're able to serve during their clinical rotations. 116 hours of anesthesia time during their clinical rotations in the last 5 years. And then just in 2022, 74,000 clinical hours. So really, you can see the amount of time and work these students put into caring for the members of our community. Most of the CRNAs that are trained at FranU continue in Louisiana and providing care to the citizens of Louisiana. And then there's also a huge demand for our students locally and nationally. When I tell you we don't even know what to do with the amount of recruiters that are calling and emailing, trying to host events for our students, I literally could not overemphasize that enough. I think our students are even burnt out on recruiting events. They're being so heavily recruited right now. So again, great time to be a CRNA, great time to be a CRNA student. And then just a few things that are going on at a university level that we're extremely excited about. Dr. Castile kind of alluded to a new building that we're working on. And so if you know anything about FranU, we're a little bit scattered throughout the medical district around Our Lady of the Lake Hospital. We're in several different buildings. And there's no one unified, cohesive campus. And so part of the university's big master plan is to have a big, unified, centralized campus for our students. And so the first step in that was the construction of St. Francis Hall. And it's a 75,000 square foot, 7,500 square foot building with 3 different levels that is going to house a lot of different student services. There are, what we're most excited about is the simulated technology environment there. And so we have 2 dedicated operating rooms for the nurse anesthesia program with 2 big control rooms. We're getting new mannequins, new equipment. We've gotten to tour it. It's very nice. It's not completely finished yet, but by the time you guys were to roll onto campus, you would be able to use these simulation spaces. We're actually planning to put some of our classes in the hall for the fall. And so in the next few slides, you'll see a few more pictures of St. Francis Hall, but it also will house a lot of student services like the library, which will have some dedicated study spaces for our students. Any kind of student services like financial aid, any kind of those kind of things that students need, counseling, writing center, things like that are all going to be located in this building. In addition, they have some plans for like a type of food court where you can go and get food and, just a little bit more kind of like a student union type feel. This is another kind of look at the inside of St. Francis Hall and some of the some of the spaces. There's a chapel there. There's our library spaces. I believe we're on the 3rd floor, Dr. Castillo. Is that correct?
Yes, I think so.
I believe this is up on the top on the 3rd floor.
Yeah, the 2 operating rooms.
Yeah, so very excited about that. And in the next few slides, you will see some actually updated real pictures of St. Francis Hall. So this is
it's not just drawings, it's actually real.
It's actually getting really, really close. And we have landscaping. Once you have landscaping, it's really close to move-in time. So we're extremely excited about this and are excited that you guys will get to utilize it. So to kind of, get to where y'all all want to be tonight and answer some of those questions about admission. So we've heard all about the program. How do we get in? So here are some of the things that we're looking for. And again, you can find most of this on our website, but after we're done with our little presentation, you'll have an opportunity to ask us any kind of specific questions. All of our applicants have to be BSN prepared from an accredited university. The minimum GPA requirement is a 3.0 on a 4.0 grading scale. And a little note on that, we factor in every attempt at every class that you've taken. And so if you've repeated a class, that first attempt still goes on that GPA calculation. Our applicants have to have a minimum of 1 year of full-time critical care experience. We, accept PICU, NICU, provided that you can demonstrate proficiency in titrating vasoactive agents and ventilator management and things that apply to an adult critical care patient. So there's probably some specific, working situations that if you're unsure whether your experience would be counted, you could reach out to us via email or ask a question on the chat after this is over. Other things that we consider for admission, CASPER situational judgment assessment results. So CASPER is a new type of assessment that we're doing this year. We used to use an emotional intelligence assessment, and we just found some weaknesses within that system. And so, when we say other factors considered, that just means it's a small piece of the puzzle when we're looking at, what we think makes a strong applicant. This is one thing that we think is going to point us in the right direction. Medical schools have been using CASPER to help select their applicants for, a very long time, and it's a well-validated test. These tests are given at a certain time. So there's certain test dates and certain test times that you'll be able to access on our website. All that information will be posted on our website in the next couple of days as far as when you can schedule that test. But it's an hour and a half-ish test, and there's some open-ended questions that you respond to, and there's also some video scenarios that they ask questions about that you respond to. It doesn't really have anything to do with clinical knowledge. It's just kind of it's a situational judgment assessment. And so there's going to be a lot of information where you can dig a little deeper and find out more about that CASPER test on our website. We also look at your science GPA, your courses like anatomy, physiology, chemistries, biologies, things like that. While it's not a minimum requirement, we do look heavily at that science GPA. And Another facet of your GPA that we look at is your last 60 hours of coursework, which typically is your nursing GPA. And so we recognize that some people started college as a freshman and maybe went a little wild for a year, and then they realized what they wanted to do with their lives and got it together. And so sometimes that's very reflective in that last 60 hours of your GPA. And so we do look at that. We will also evaluate your clinical knowledge during the interview. And so, not necessarily that you get every question right, but kind of the way that you answer your questions, and the ability to demonstrate that you know how to take care of a critical care patient. We will kind of evaluate that during the interview process. Your CCRN status. For a first-time applicant, your CCRN is not required, but you do get extra points, I would say, during your interview for having your CCRN. And also, if you have your CCRN score report, we want to see that too. We'd like to know how you did on the CCRN. Besides just passing, we'd like to know what your actual score is. Your GRE, again, not required, but we do look at that score. And so if you have it, if you performed well on the GRE, then we'd love to know that. You get a little extra, again, a couple extra little points if you did really well on your GRE. So those are some other things that we look at in the admissions process. These are kind of some numbers for you guys based on our last year's admissions statistics. We got 266 total applications. We interviewed about 150. We accepted a cohort of 40. And this is kind of our overall GPA for those that were accepted and the average science GPA for those that were accepted. So 3.6 overall, 3.7 science GPA. So what can you expect on your interview day? We try to keep it pretty laid back and, kind of get to know you. We spend about 30, 40 minutes with you. Usually in an interview room, there's about 3 or 4 faculty. Some of those are our full-time faculty. Some of them are clinical preceptors. Some of them are clinical coordinators or adjunct faculty that we highly value their opinion. So we ask them to sit in with us. And so 3 or 4 people will be present in your interview. We also ask our students to come and volunteer a day and come kind of walk you around our simulation facilities and really kind of answer questions for you guys from a student's perspective. We can answer questions all day long for you, but we aren't sitting in the seats. So the students are really valuable during the interview process. And all of our applicants in the past have just really, really spoken highly of the fact that they were able to talk to them and kind of get some of their nerves, worked out before they walk into their interview. Some of the interview type questions that we ask, we really want to get to know you, what you're all about, what your clinical experience is like. We will ask some clinical knowledge questions. Try to tell people not to get too hung up on that. Just know what kind of patients you're taking care of, know about them, and know, why you're doing what you're doing at the bedside, and you'll be fine. We want to see that you know what you're doing. And we want to see that you're confident in your ability to answer clinical questions. Some situational judgment type questions will be included in the interview process. And then as far as some dates, some application deadlines is July 1st is our absolute last day to turn in applications. Again, pay attention to the CASPR testing dates on the website because those CASPR testing dates will have to be taken before the application deadline. Our interviews this year will be conducted August 3rd and 4th, 7th through 11th, and 14th through 16th. Once we complete all of our interviews, it usually takes us a couple of weeks to kind of make our final decisions on who we will invite into our next cohort.
And if you don't get an invite or immediately, don't get too discouraged, because a lot of times, there's anesthesia schools that are inviting different people at different times, and people are applying to different places. You may have one that was right next door to you, or for a family reason that people change their mind. So it's not uncommon to see, you offer a 40 cohort and then you start to go down. We generally have way more than 40 people that are yeses for us. So don't get too discouraged if you don't get that letter right away, because it still could happen for you.
And what that would mean is you'd be placed on the alternate list. And then we kind of go down our alternate list if someone chooses to go to a different program.
And some of the other things I'll mention just real quick that Dr. Dorn, like while we have a sort of rubric that we tend to use with our, interviews, and that's to keep everything fair, to keep everything equal. We also do like to hear about you. We get to make personal like assessments and judgments. And so we understand that, certain struggles in life might actually make you a much better person than somebody who just has a 4.0 GPA and can't relate to, handling an entire situation. Because in anesthesia, a lot of times it doesn't go perfect. I mean, it's chaotic. Sometimes it's, you have to think on your feet. You have to make these different types of decisions. So it's one of the things that we're kind of passionate about, is getting to know the person. Now, in all fairness, we have to believe that you can, do it academically, because if not, we're doing you a disservice to put you in, $150,000, $200,000 in debt. If we don't think that you can, academically do that. So while grades are very, very important, we do like to look at the, the whole picture of students. So don't get too discouraged if you don't have the 3.9 GPA and all that. You may be very, very strong in the bedside area. There might be a bunch of different things that can, make you a really, really strong candidate. So just thought I'd throw that out there.
Thank you. And then just, lastly, we have a social media account that we've started in the last couple of years where we post a lot of fun things that we're doing around campus. And so I encourage y'all to follow us on Facebook, Instagram. I even got a TikTok this year. I'm pretty excited about it. I'm really, learning about all these things. So I think that's about all we have for y'all as far as what we want to tell you. So we want to hear from y'all and know if you have any questions for us tonight.
And you can ask us anything you want. You can type them. You can shout them out. You can do whatever. We'll try to answer as best we can.
Chats. Let's see. So I have one asking about traveling. Currently doing travel nursing, working at night, don't have much opportunity to build a rapport with the managers. Yeah, so
the answer is yes.
The answer is yes. So you can use a manager or a supervisor from your previous job, as long as it's within the last year or two of your work experience. We just want somebody that can speak to your ability to work and not cause any issues on the unit, and how you work well with your team and things like that. So it can be your previous supervisor.
That's basically what I'm looking for. If you've only been in a unit for a month, I actually prefer
somebody who can really
the one
speak
that you've worked with for 3 or 4 years. Yeah.
And another chat, thoughts on students who have young children and families. We have a lot of students who have young children. We have a lot of people, the males in our cohorts tend to have lots and lots of babies during the program. Would you agree with that, Dr. Castillo?
It seems like it, I don't know.
On one hand, having young children while completing an anesthesia program, it's difficult. I'm not going to say that it's easy. However, I do think it gives students a different kind of motivation for succeeding. And we have students every year, every cohort, who have toddlers, newborns, you name it, and they do very well.
But to answer your question, it will be harder than if you're just a person that's completely single by yourself with no kids, and you can be as selfish as you want and study anytime. So I admire people that can go through that. The children and families, you have to realize that one thing that's very difficult for a lot of people to understand is that while you may be successful and you may be motivated and you may be driven to do this, you have to make sure that the entire family and the entire support system is on board with it, because you being driven is not enough if not everybody's on board with it, because it really does take a village to kind of get through these things, and you're going to need help, and you're going to have to ask for people to watch your kids. And I mean, we have people that, what do I do with my dogs? And I mean, but we also are, as a faculty, understanding in the sense that we have lives too. Like, I'm surprised you haven't heard anything crashing behind me over here. So we understand where you're at.
I threatened my kids' lives before we started this meeting not to come here. So we all understand. That was what I wanted to say is make sure you have a strong support system, regardless of whether you have young children or not. The support system's everything. So you really need to have that in place going in. Let's see.
It looks like we have a question about, is a particular type of ICU experience
Hey,
preferred?
I'm sorry,
Uh,
Dr. Castillo, we had a hand raised
Yeah.
to do a verbal
Okay.
question before all these chats came in.
Sorry.
All right.
Hi, I think the hand raises me. Good evening.
Hey.
Hi. Thank you all for taking time to have this session. I guess my first question was, what is it that you guys look for in a potential student that will show success in the program? Anything off the top of the head?
If I knew that, I'd be a millionaire. No, but I can tell you that it really depends. I think I'll take this in the person. I mean, obviously some generalized characteristics that we're going to look for is somebody who is, of course, driven, somebody who knows what they want, they go after it. But we also have to have the people that are, you have to be empathetic. You have to understand what people are going through. You have to be academically able to complete the program. There's a lot of people that have dreams and wishes, and while I don't want to squash those dreams and wishes, I also have to be a realist and make people understand, like, sometimes it's got to be a good decision. I mean, we've all seen the American Idol where they send somebody out there and the parents are like, oh, they're the best singer in the world, and it's like, no, they're really not. So we you got to be honest with yourself, and that's one of the things that we do. Even with people who don't get accepted, we send you kind of a self-evaluation, a self-reflection, like, well, I can't believe I didn't get in. Well, what's your GPA? What's this? How did you do on those kind of things? So I think looking at all of those kind of things, from me, I look for, you have to have the personality to do it. And that can be a varying personality. It can be somebody who's quiet, it can be somebody who's loud, it can be all these kind of things, but all CRNAs have a certain factor, and you can't put your finger on it right away or label it, but there's something about them that drives them to be just, they want to be at the head of the bed, but they want to kind of be silent, they want to be kind of in the background, but don't mind stepping up when necessary to do those things. And you really, really have to be motivated to learn, and to learn to the level that you've never learned before, to study, to sacrifice. It is a rough 3 years, and I'm not trying to talk you out of our program, because I want you to come and I want you to be a CRNA, but it is legitimately, it's not something to take lightly. Every student that I've ever had that struggle or have problems, and I asked them, like, is this what you thought it was going to be? And they're like, no, it's way more than I thought it was going to be. And I can't stress enough how much, it's not because we're mean, it's just a large volume of information in a very short period of time. It's like drinking from a fire hose. So we look for people that can handle stressful situations. But the other thing that we try to provide for students is, we understand that while you may have been stressed at different points in your life, while you may have been pushed in nursing school, you've probably never been pushed this way. So it doesn't necessarily mean you're going to absolutely know how to handle that. You may think you can handle it, and you may very well, but you also may have never been pushed to the point where it causes you to, well, man, I always made A's on my nursing test. Well, yeah, but you never had to been pushed to this level. So we offer student services, we have counseling, and we are very open to having our students come talk to us. And sometimes it's what do I need to do differently? I'm like, well, you spent 13 hours studying, but did you spend 13 hours studying, or did you stare at a book for 13 hours? So sometimes it's changing your study techniques, being able to adapt. All of those kind of things are things that we look for, along with GPA, clinical experience. All of those things are going to matter in an interview. But if you can get through that interview and you can show us that this is something you really want and are academically capable of doing it, I can never predict, if I could put my money on it and say this person's going to be successful and then the next one's not. And sometimes, unfortunately, if students are unsuccessful, it has nothing to do with anesthesia school. It has to do with life. It has to do with some outside factor that we can't control for, but we certainly are going to try to help you get through it if that does occur.
Thank you for
That's
the
kind of a
insight.
long answer.
Yeah. Okay, let's see. Particular type of ICU experience preferred. A particular type of unit, not necessarily, but a unit where you're handling a lot of, vent management, a lot of vasoactive drips, a lot of sick patients, surgical procedures that are advanced, all those things are wonderful. I think, if you're in a smaller ICU where you're not getting those kind of experiences, I think you should consider maybe moving to a larger hospital where you're going to be taking care of higher acuity patients. I think that's the biggest thing, more than a certain type of CICU, MICU, SICU. It's the acuity level of the patients that I think you need to be looking for. And, and it's like Dr. Castile was saying, it's what you do with that experience that's going to really shine during your interview. You can work at a, level 1 trauma center and, in the best academic teaching facility where you're seeing the sickest of the sick patients. But if you're not really diving in at the bedside and like learning about those patients and their pathophysiology and the pharmacology of the medicines that you're giving, that's going to come across in the interview. We've seen some applicants from the best, ICU, we would say, and they didn't do very well in their interview because they didn't really know about the patients they were taking care of. So, you got to understand what you're taking care of.
And the other caveat to that is years of experience does matter if they're good years of experience. But I mean, I know people that, we've all seen ICU nurses that may have been in ICU for 10, 12 years, but it doesn't mean they're necessarily better than the student or the person that just graduated who's hungry and who is learning all these things and who was put directly into taking care of hearts or taking care of, really, really sick neuro patients. So it is kind of, get your hands on as much as you can, advanced procedures, ventilators, balloon pumps, impellers, all these kind of things. And if you can't, that's okay. It doesn't mean that you're not going to be, a strong applicant. What we really look for, and I'll give you a hint, a lot of times I ask you what you like to take care of, what kind of patients you want to take care of, and then I expect you to be able to tell me about it. And so, you really have to know about what you're taking care of. So that's kind of something to think about is if you take care of neuro patients, we would expect you to know about, ICP, or something to that effect. And that just shows you're going to a different level than some people who are just going through the motions.
So the next question is, do you get any extra points or credit for having a master's degree, non-nursing? Sure. I mean, it really depends, I guess, on like, what kind of degree it is, how well you did in that degree. There's a lot of factors that go into that. But yeah, certainly if you've done, have your master's degree and you did really well in that program, it shows your ability to handle graduate curriculum. You agree with that, Dr. Castile?
Yeah, I was going to say, I mean, and you got to realize we look at all these different applications and all things being equal. If I'm looking at a person that has a master's degree, maybe not non-nursing or nursing or something else, the unknown is that one person doesn't have, graduate level schooling, the other person does. There may be some times when you can look at that and go, well, number one, I know you're committed. Number two, I know that you spent the time to go through that and completed it. So, I can see that you've completed two degrees versus one. You could also look at it as, well, I wonder what was unhappy about or why they chose to do this degree versus this degree. And that can tell you something about your life experience or your life changes. So all of those things kind of factor into it. And that's what I mean by we look for the whole thing. But as far as like, a standard like, oh, you get 5 extra points because you have a master's degree and this other person doesn't, it's not exactly that way. But with all things being equal, if I'm looking for like, I'm not really sure, but I think they can handle it because of this, then yeah, of course it's gonna factor into our decision-making process.
The next question is average age of the class, and do you look at age? Okay, so I saw your question. I'm racking my brain because I know I reported this when I did that LCMC grant. I want to say it's like our average age is like 30.9 or something like that. I think it's right at 30. And no, we don't really look at age per se. I'm not
We don't
gonna
discriminate on age.
we don't discriminate based on age at all. I would say most of our students are, under 40, I would say, but I mean, we've had people
some that aren't, yeah.
who've done really amazing. But no, we don't typically even look at what age you are.
And that's not necessarily based on what we choose. It's also about what comes to us, so if we have the large majority of people between 25 and 35 and 150 of them are in that age range, of course, we can have probably higher percentage of that in our classes. And that's kind of what's reflected. The only thing that I have kind of noticed about some older learners is that, not that it can't be done, is just from a realization, even myself trying to figure out some of these technologies, that like if you've been out of school for a long time, it's not necessarily the age of the person, it's how long you've been out of school. How long has it been since you've written papers? How long has it been? I mean, did they have Moodle and Blackboard and all these different things and the internet before was it invented at the time? I mean, all that's gonna really affect how you how well you do in these programs, because you're going to be in a situation where you may struggle more than somebody else. And it's not because you don't have the knowledge to learn the anesthesia, it's because you might be struggling with some of the technologies or those type of learning where you're not used to online learning type of thing. So, but as far as us making that choice based on that, we don't. I just like to tell people that's something to consider, that, you know, education has changed significantly in the past 10 or 15 years, you know.
All right, I have one in the chat. I'm a new grad from ULL, just started ICU, taking a CCRN, going to take the GRE. My 3.09 cumulative is a main concern. So moving forward, what can I do to improve application? GPA is not the only thing that we look at. So it's kind of hard to answer that question without looking at your entire application. So if you wanted to like shoot an email, I could probably answer more specifically. But just the other things that we mentioned as far as your experience and being able to answer clinical knowledge questions and how well you do on your Casper thing, how well your science GPA was, how well did you do in your nursing curriculum. So there's a lot of factors that go into kind of that decision or that advice I would give to you. So if you want
to
here's
the other thing that we can't control for, is that depending on the amount of applicants and depending on the applicant pool, that also affects things from year to year. You know, if we have 10 applicants and they all have a 3.1 GPA, that's a lot differently than having 265 applicants that have 3.8 or 3.9 GPAs. So it kind of varies from year to year depending on what we're looking at. The other thing, and I don't know, Tilly, is this something that the other concern that I have is sometimes when people are very, very close, and since you're giving us your GPA, is making sure that it's calculated correctly in a method that, you know, we don't want you to get, you think you have a 3.09 and it's a 2.9 because you didn't factor in a certain class. Is there something they can do with that, Tilly, to make sure?
I'm always happy to take transcripts. You can email them to me. I recommend, I can put my email address in the chat. I don't mind. I'll give everybody a full disclosure though. I am going out on 2-week leave starting the 23rd. I'm probably going to regret telling y'all that if anybody wants to send me transcripts now. So please just be gentle with me if you do send me transcripts and I don't respond to you promptly. I am expected back in the office March 13th, which is plenty of time for you to get that information. But I'll put my email in the chat. I'm happy to review transcripts. The caveat is I need to see all your transcripts. So if you've been to more than one school, I understand that it may be printed on your transcript, but I would need copies from all schools you've attended, including dual enrollment if you took some classes when you were in high school. And I'm happy to look at those transcripts for you. I think both of our program directors online would much prefer I let you know where you stand GPA wise, than you go through the process and you were just that close to applying and you spent your time and your money and that GPA was just a little off. So I'm always happy to review your transcripts. It will not be a bother, but please be gentle with me as I will be going out on leave until the 13th, starting next Thursday. I'm putting my email in the chat now. You can find me on the website.
And I would suggest too, if you know your GPA and you're close to that 3.0, those are the people that I think should kind of, you know, email Tilly. And number one, be nice. Be nice to Tilly, okay? Because she helps us a lot. So I'm gonna put that warning out there. Be nice to her, and she helps us a lot. She's here for y'all. She's really trying to make it better. But yeah, don't, you know, if you have a 3.7 GPA, it's not anywhere close to 3.0. I wouldn't waste your time, you know, trying to figure all that kind of stuff out. It's if you're kind of on that cusp and you're worried about it, that's the kind of thing that I would just make sure that you're, like she said, you don't think you have a 3.1 and you end up with a 2.9 and you've wasted your time and you know, your application fees and that kind of stuff. So,
and I mean,
not everybody needs to send it in.
Now that you have a 2.98, there's things you could do, and I think you'd rather know that now.
Right.
Also, I'd like to say if you have more than one school, and I mean like you've attended maybe 3 or 5 schools, that'd be a good example of, I'd be happy to look at your transcripts, because every school is different on what they calculate in your final transcript. So please, if you've been to more than 2 schools, I would not try and calculate that on your own either.
And full disclosure, she is the one that will be calculating our GPAs for us. So it'll be standardized. It won't be multiple people doing it different ways.
All right, the next
All
question
right,
is, how many hours would you recommend to shadow in the OR? My recommendation would be as long as it takes for you to realize whether or not you want to be a CRNA. You know, I think, a couple of days, maybe shadowing like a CRNA that works in a certain type of setting versus a totally different hospital setting. Like, I would just maybe spend a few days and make sure that that that's really what you want to do.
Yeah, we don't have a minimum or a maximum. I do like to see it, but we all are also aware that, especially during COVID and with hospital restrictions, a lot of times it may be harder and harder for you to get in there. But if you can, it like she said, Dr. Dorn said, it's making sure you realize what we actually do for a living, because it's sometimes what you see of us in the ICUs is not the actual day-to-day what the CRNA does. So we just want to make sure that people are kind of aware of that type of thing.
All right, the next question, what is considered a decent GRE score for the program in order to get extra points? I would say greater than 300 is a good GRE.
I believe in the past when we made the GRE, it was what, a 290, I think, was the actual
290 was our minimum
cutoff,
requirement.
and a three on the writing maybe.
And a 3 on the writing was our minimum.
Yeah.
So, but I would say, the most programs who do require a GRE are asking for a 300 minimum now. So,
yeah. And once again, you don't have to have it, but it's one of those things that if your GPA was a little soft, but you really did awesome on your GRE, why not send that in and kind of boost up your education, requirements. If your GRE is really not great and your GPA is, I'm going to give you a hint. Don't send in your GRE if it's not really good. Are really, really low. We don't want it to hurt you. It should be there for you to show off and for it to help you. So just when you look at your application, look at it like we will in a whole holistic way of there's this plus this plus this, and we kind of can balance it out. So that's kind of what we're looking for. We're giving you multiple ways to present yourself in the best light.
all right, question about NICU experience being considered. Is this a demonstration of competency going to be in the form of a test or acuity of patient represented in a resume? So it'll be more in the form of a clinical knowledge question in the interview. That's how that would be evaluated.
And I guess the best way to present that too was that we used to not accept NICU and PICU, and we were kind of, for lack of a better term, eliminating a very, very strong portion of nurses who actually do very well. But it matters. It matters on the type of NICU you're in, the type of PICU you're in. You can't tell me that a NICU nurse is taking care of post-op, day-old hearts is not a high functioning ICU nurse. So what we're trying to do is just make sure that we don't eliminate people based on just the the NICU or the PICU, but we also want to make sure that you have the type of experience that we're looking for. So yeah, we won't make you take a written test, but just like with the adult ICUs and just like cardiac versus surgical ICUs, we want to know what type of patients you take care of and what the level of acuity is and kind of your knowledge base in that.
What are the most recent attrition rates for the program? Okay, so let's see, last class, it was 6,
right?
It was 6% attrition for the class of 2022, 6%, and the class of 2021 was 10%. And I couldn't tell you the year before that. I'd have to go look it up.
Yeah. And those are questions that I know people ask, and all I ask is that you be careful when you look at attrition rates, because what you want to assume is that that's not going to be you, right? You don't want to be one of the ones that doesn't finish the program. And it is important, because if we have a program where we're continuously selecting the wrong students and they're not succeeding, well, then there's a couple of different reasons. Maybe it's we selected the wrong student, maybe something happened to that student in between, or maybe we're just not doing a good job. So what I like to do is kind of look at it over the years and kind of see where you're at, because there are times when, and I'll give you a little insight, we have to report attrition, and there are times when I might accept 40 students, and before we even start classes, or like the third day of classes, before they take any test or do anything, I might have 2 or 3 people that had to drop out because of a life event. And so that counts towards attrition. So there's a lot of reasons to look at it. And what you want to look at is that attrition related to poor teaching? Generally, if you have a high board pass rate, there's probably some good news there, like, because but we certainly do not try to filter anybody out. I mean, our goal is like, it looks bad on us. My goal is to get you in and to get you to graduate and get you to become a CRNA and we can be proud of, because the more we lose, we don't get bonus points for that. We don't get to replace you. We don't get to do any of that kind of stuff. So it's something to definitely look at, and it's a valid question, but make sure you take into the entire account of how it's, calculated.
Next question is, are all cohorts the same size, or do they vary from year to year? That's a good question. So about I think it was 3 years ago, we increased our enrollment from a max of 35 to a maximum of 40. And so we're starting to see, our classes go from about 28, 29 to 38, 37 in these upcoming cohorts, these last few cohorts. So we just graduated a class of 29. Behind them is a class of 26. And then we have a 38 and a 37. So they vary.
We look for, they vary on many different things. And we also, because we can accept that many, it doesn't mean we will always, like, we don't have to take 40. We try to, and if we have 40 candidates that are good, we're going to offer, but we're not going to, like I said, put somebody in a situation that we don't think is going to be successful just to fill our numbers. Let's see, what kind of board review or board prep do you utilize? Currently, we actually use Apex. And Apex is a CRNA owned company that is very good for board review. And it's not just kind of like, the last 3 months you take this board review. It's something that we've kind of over the past 2 years implemented into our actual curriculum, and we use it to kind of start teaching all the way back in we used to give them Apex access just your senior year, basically. And then in this past year, we moved it all the way back to now in your junior year. So you get 2 full years of Apex board review. Yeah. That is included with that. And then we are currently, this last class that we had, we paid for them to attend Valley, either virtually and receive all of their, the materials, or if they wanted to pay for their own travel, they could go to it live. But either way, we paid for their registration and got them the information for it. So we used Apex and Valley. I think that I used Valley when I graduated, but Apex didn't exist. And so we're just trying to give our students kind of a combination of both. But we've been very, very happy with Apex and the way that they take on the boards, and we've been very successful with it. So I envision us continuing to use them.
All right, next question. Aside from job shadowing along with the GRE and CCRN, what makes a candidate's application more competitive? What opportunities for additional nursing research does the program offer? As far as application, just, things we've already mentioned as far as your work experience, those different facets of your GPA that we look at. And then your interview makes a big, it's a big, important piece of the puzzle, how we interact with you, how you handle yourself in a stressful situation, like an interview for a CRNA school, your clinical knowledge, all of those things that we kind of hit on earlier. And there's no one thing that I can point to that says this is what makes a great applicant. It's really a big puzzle piece. There's so many different facets that we look at. And for lack of a better word, we're really looking for that it factor. There's just people who walk into their interview and like they got it, and they can do it. And so, I don't know that I can put a definition on that, but it has a lot to do with your confidence and your experience and how you handle yourself in that situation.
And humility. I mean, and knowing when you're like, you don't know, or you're wrong. Like we're reasonable people and understand that, like, if you go down the wrong pathway and you or I ask you like, why do you have an F in organic chemistry in your freshman year? And you're like, because I didn't know I wanted to be a CRNA and I was just goofing off and I made a bunch of mistakes. But you can see after I decided, like that's real life. I can understand that. But for us to understand that, you have to understand too that we have to start at a certain level. We can't offer as many spots as people apply. So we have to have kind of basics. And then from there, we start comparing and looking at things to where like, hey, I really like, there's something about this person that really they can do it and they have a good grade point average, or look, they didn't do too well in this course, but look, they came back and they took this again and they made an A in it and they showed us, like this is something that I really want to do. So it's showing that drive, it's showing that desire, and also just kind of, having all the things that check the boxes.
What additional nursing research does the program offer? I think that you'll find that you're going to be pretty in the weeds on research once you get into the program. However, we do offer, one of our groups in the DNP project right now is doing a quality improvement project at Our Lady of the Lake. There's plenty of opportunities to get involved with faculty on research. But the rigors of the program, the time that's required of you, there's not a ton of extra time, I would say, for research opportunities.
Yeah. We're going to teach you how to interpret that research and become an expert in translating that research. And then from there, you'll be able to take it and you can run with it as much research as you would like to do. But like Dr. Dorn said, I think that in the interim, it's going to be difficult for you to take on anything extra than we kind of assign or provide. But being in contact with all these clinical partners is going to afford you the opportunities to meet the right people, to be in the right places that you can build on that, that degree that you're going to have. What's the next one? Is it the critical care? Is that right? Interventional radiology. Yeah. Should I consider going back to critical care full time? For me personally, I think it depends on how long you have been out of the ICU. So we'll look for ICU experience. And then, like we said, current defined as what do we say, Dr. John, within the past 2 years, ICU experience. So once again, the more you're working in an ICU, I can't tell you that's going to hurt you at all. But I also can't say that, if you're working in interventional radiology and you're picking up at a level 1 trauma center, your experience in ICU at the level 1 trauma center may be very sporadic, but it also may be way more valuable than somebody who works in ICU every day and they don't take care of anybody that's really sick or do any kind of advanced procedures or any of those kind of things. So it's really just kind of one of those things, but I don't think it would hurt to be back in critical care. But that's a decision that you have to make personally.
Yeah. And to piggyback, it matters how long you've been PRN and how much you're working PRN. So if you're working, 2 extra shifts a week, that's probably sufficient depending on how long you've been out of the critical care, full time. So a couple of different factors going into play there, but I echo that sentiment that it wouldn't hurt to be in the ICU. All right, let's see.
Tilly, this is like a question for you.
If it's Ethan, I just sent him a direct message.
Okay.
Okay. All right.
All right. So we got an ICU ED nurse with CCRN. Want to do medicine, pathophys on a much deeper level. And I want to do lots of procedures, art lines, central lines, intubations. From you guys' perspective, would CRNA or med school be better for my situation? I went back and forth on this topic for a while now. I don't know if I could answer that for you. That's such a personal question. It's really what is best suited for personality, and what you.
I think I could take it. What I would say too about that is, you got to look at it from a perspective. A lot of times, and not you, but there's a lot of times that people will think that, we landed on CRNA school. Like we attempted to go to med school and we failed and we just landed on CRNA school. So a lot of times it really just depends on what you want to do, because I can tell you as a CRNA, you're going to do procedures, you're going to do central lines, you're going to do intubations, you're going to do all those kind of things. You're going to learn medicine and pathophysiology on a much deeper level. I would imagine you'd probably do the same thing if you go to med school. The question is though, what do you want to do with your degree? Do you want to take care of people in the operating room? Do you want to do anesthesia? Are you talking about being an anesthesiologist? There's multiple levels of that to that question. You know, if you go to med school and you're a general practitioner, you're not going to be doing any of this stuff. If you go to med school and you become an anesthesiologist, depending on where you practice, you still might not be doing any of this stuff. You might be supervising CRNAs. You might be in you know, do you going to go get a cardiac fellowship? There's a ton of different aspects to that. So I would really, I hate to give you an answer. I mean, I'd tell you to be a CRNA. I'm very happy with my choice. But then again, I know some guys who are MDs who are probably very happy with their choice. So it just depends on what you want to do in your life, where you are time wise,
My
you know,
recommendation
money.
would also be to shadow, you know, the different
Yeah.
specialties you're considering and see what you really think about the day in, day out, you know, job that they're doing and what you think would fit you, your personality the best.
Yeah.
All right, let's see. When accepted, what can I do between now and the beginning of the program to adequately prepare myself? So we get this question quite a bit. And I would say, you know, the best advice is to stay at the bedside, to continue to, you know, those patients that you're taking care of that are sick, you know everything that there is to know about them. You know, as nurses, sometimes we get very task oriented and we check all the boxes and we get everything done, but you need to know why you're doing each of those interventions. And like, all right, I'm about to hang this new medication. Like, what is this med? What receptors does it work on? Go to that next, you know, deeper level, that cellular level. And that's the best way that you can prepare. And also, you know, take a little time, go on a little vacation, spend some time with your family, you know, enjoy your freedom for a little while before we take it all away from you for 3 years.
Yeah. Yeah. Don't start studying and buying books and all that kind of stuff. We're going to teach you what you need to know in anesthesia, but it doesn't hurt for you to know what you would, you know, which the things that you have available to you now that you can learn on a daily basis. Like, you know, Dr. Dorn said, if you're going to give Levofed, instead of just going, well, I know the blood pressure goes up. Well, why does the blood pressure go up? You know, you take it to that next level. And I know that's hard when you're working 12-hour shifts and you're doing those kind of things. But if you take a little bit of that each day, you'll start to realize like what we're getting into, and it'll make things a lot easier for you when you get into anesthesia school. As far as DEI efforts, has the program taken to invest in its diverse students? Well, there's a couple of things that we do. One of which was we used to require the GRE. We took that away and said, you know, it's an option because we didn't want to take it away from people who could do well on it. But we do know that the GRE was never 100% certainty in demonstrating success on a graduate level program. We also know that it was kind of set up for people who come from different backgrounds that aren't exactly given the same kind of fair shot. And it was a test that was kind of more designed to somebody who grew up, you know, learning a lot of stronger maths and these kind of things. And traditionally, women and you know, economically disadvantaged people, underrepresented groups don't tend to have the same level of scores on it in these particular situations. And that's because it was set up in a situation where it wasn't taught the same way. So that's one of the things that we've kind of done to hopefully make things more equitable for everyone. The other thing that we do is we reach out in one of these, what Dr. Dorn was talking about earlier with LCMC, one of the goals of it was to increase diversity and inclusiveness in our program. And one of the things that Dr. Dorn, can you speak to this? One of the things that we had talked about through the process was with.
So the goal, one of our goals that we spoke to was to increase the diversity of our applicant pool, increase the diversity of our students, and then increase the diversity of our healthcare workforce that goes on to work for this health system. And so some of the things that we spoke to were recruiting at, you know, different colleges that are underrepresented or that have, you know, underrepresented groups. And then also there's a sponsorship program called Diversity CRNA that our program plans to sponsor. And that will also increase the diversity of our applicants and kind of connect us with some more diverse applicants. What else was one of our goals?
I think one of the big things that we try to do too is that the more diverse you can be as a program, and the more you can get people of different backgrounds to interact. Like for instance, this the service learning, and when you have a little kid that sees someone that looks like them and comes from a background like them and goes, wait a minute, I can do this too. The more we can do that, the better it is for everyone, because it's it helps the program, it helps the community, it helps everyone involved. The other thing that we've looked at is,
cool. Oh, go ahead. I'm sorry.
Go ahead. Well, I was going to say the other thing we looked at is that traditionally the CRNA, in the United States, I'd say 35 to 40%, of economically disadvantaged or underrepresented groups, but in the CRNA population, it might be only 11 or 12%. So at FranU,
we're actually way more diverse than the population of CRNAs across the country. Our program is much more diverse, and I wish I
think
could
we're in the 30% range. I think it's close
we're like
to the 30% range
versus 12%, I think.
So it's something that I think that, and I'll be honest and say I don't even know if it's something that we've always prepared for, but I think it says something about our university in terms of just organically, it's what we migrate to. We're faith-filled citizens. We help serve. Those are all big things to us, and I think that helps attract a certain type of person that we're looking for, regardless of their background or whatever. And then the other thing that I think helps is that we find, or Dr. Dorn through research has seen that people have, that are underrepresented, economically disadvantaged, tend to worry more about or come out with more debt a lot of times. And so one of the things that we're doing to try to offset that is make these partnerships with facilities where we can kind of level that playing field. You can say it's 100,000, but we're going to give you 60,000 if you go work for this university or work for these people, to kind of make it a little more equitable for everyone. So those are some of the kind of things. And then even in our interview process, like I won't go, like I said, the term holistic admissions, this is something that we're looking at, and I'm realizing that while it may not be on the checklist, it's something that we have done since I've been here. I know that, like, I listen to people's stories. I understand that if you have a 3.8 GPA and you've, raised children by yourself, or you've been in a situation where English wasn't your first language, and you came here, and that says something about desire and drive and the ability to handle, stressful situations and all those kind of things. So all things being equal, those are going to help us go, well, you know what? That's what CRNAs do. That's what CRNAs deal with. They deal with adversity. They pivot when something happens, and they fix it, and they do those kind of things. So all those things matter to us. We look at, I think I was talking to Dr. Dorn the other day, like college athletes, they're coachable. We know that. We know that those kind of things sometimes, while they're not on a checklist, your story does help, to do the whole, kind of give us a picture of the whole person, because we know that it's more than just a GPA, but we also know that we have to have a starting point as well. Hopefully that helps.
All right, we're going to take one more question. Okay. Is there any time or space in the curriculum for mission work? There is. We can't count mission work as clinical anesthesia hours, unfortunately, at this point. However, one of our seniors that just graduated was able to go to on a mission trip with she partnered with one of our clinical sites. They host mission trips frequently throughout the year. And so she was able to go spend a week. And where'd she go? Gosh, I'm blanking on all these.
Was it Honduras?
Places. I think it was Honduras.
Was it? And that's not our rule in terms of not being able to count those cases. That's a council on accreditation rule that you can't count them. So it doesn't have to do with us. We do still think it's a good experience. We'll actually I think we gave education for them to travel through that. So we're definitely we're pro those things. Yeah. Did we get everybody?
I think so. Tilly said you had one more.
I answered it in the chat, but it has come to my attention this week. Thank you to a applicant. that somehow the one of the certifications is missing on the drop down. So if y'all encounter that, just please be patient with me. Our CRM administrator is working on it. It should be fixed by the end of the week. But if you have any concerns, you can reach out to me if you don't see it by Monday at the latest. And it's the ACLS, I believe, that's missing from the drop down, but it should be corrected by tomorrow, but give us till Monday.
Well, before we part tonight, we are recording this session, and Tilly, will that go out via Slate or?
Yeah, so what we'll do is we'll pull the recording and it'll be posted on our website. It'll come out to you guys as a thank you and it won't be your immediate thank you email, but the recording will be available for you to go back through if there's anything you want to share with your colleagues or just refresh. Maybe you missed it, you can go back through that. And then I'm also putting in the chat right now, we are hosting our second DNP open house. I'm very excited about this. Our university is small, so our chances for you to come on campus can be limited to see what you want to see, because our students are actively learning and are out and about. So DNP open house will be May 11th. I'm putting the link. Muted.
You're muted.
Myself and okay, and you can sign up for DNP open house as well, which will be May 11th. And of course, if anybody has any questions for me, application wise, transcript wise, please email me.
And in that particular open house, we're try to have faculty there, and you get to meet people and students and those kind of things. So it's a good idea to get in there and see what's going on.
Applicants from last year really enjoyed that event, and I think it decreases some of the stress when you go into interview time to have seen some faces and seen the building and learned a little bit more about the process.
I was just about to say, so this new building that we're very excited about for our students and all this new equipment that Dr. Castile was talking about, it will be mostly available for everybody to see May 11th. I'm assuming everything will be set and ready to go by then. Fingers crossed.
Thank y'all so much for joining us tonight. It was really nice to meet all of you. And if you have any questions, feel free to email us after this is over.